So first of all, I do want to take this opportunity to say thank you, Gita, very much for the very gracious introduction. I appreciate it beyond belief. You never really realize the power of words and the power of the acts of kindness and the power of, even simple acts like a smile or a compliment about a smile or an outfit or shoes. I think I was actually just having a conversation with your assistant, and we talked about how women can sometimes be such haters when really we need to be empowering each other, lifting each other up. And so Gita, Erica, and Lori, what I really want to say to you, and certainly Gita and Erica, we've known each other for a while now, and that comes from being moms and children. One of the blessings about children is that they certainly bridge the gaps and they make you stretch outside of your comfort zones. And what I will tell you is that surprisingly enough, I am not the most social person that you will ever meet. I actually am a bit on the shy side, and my wife, I always tell people, is really the PR of our relationship. So, she's the one that most of the moms know and certainly love, because if you are seeing me, that means that there's really a problem. So I am the one that typically gets to deal with the difficult things. But, Lori, I certainly just met you today. Erica and Gita, I'm proud of all of you women. And certainly when you're a mom in a small community, you peripherally know what's going on in the happenings of other people's families, because the children say a lot. The children share maybe too much. But what I want to say to the both of you is that we've seen you transitioning, and I'm so proud of both of you and seeing how you've come out on the other side. And quite frankly, I don't know that I expected anything else, knowing the kind of women that both of you are. And to Lori, what I will also say to you is that based on the company that you keep, I also know that you are quite a powerhouse. So the whole concept behind WHEEL, women helping educate and elevate lives, I think is pretty astounding. And Gita, I remember getting emails from you over the summer about this whole conceptualization about what this organization / group was really all about. And I have to tell you, I was so impressed with not only the thought, but the intention behind what you wanted this group to represent. I'm blown away that you women have been able to utilize your collective experiences and share your testimonies to help other women. And what I just said to you earlier today, Gita, is miraculously enough, my wife knows that I talk to my dad on a daily basis, and I can never speak to him without getting some kind of sermon. I happen to be a preacher's kid. But what he said to me when I told him that I was speaking at this event is, he says, Angela, you can't have a testimony without a test. And you women have passed the test with flying colors. And the fact that you are willing to share your experience so that other women who are also going through similar experiences can benefit is kudos to all of you. When I was talking to my father this morning, I also said to him, Dad, I have no idea what I am going to say to these women. And I'm like nervous, I'm scared, I haven't had time to prepare for this because I'm seeing patients, and I'm worried about the robotic surgery that I have to do on Monday with the surgeon that is my friend, but I've got to be on my A game, and I've got to go over this in between seeing patients, and I've got to talk to women and ask women what they want to hear about. And my dad said, well, being the pastor that he is, just pray to the good Lord and ask him to be with you and to give you the words. And because your intention is good, it will just come to you. So I am really hoping that that is going to be the case. I'm like, Jesus, help me, Lord, please, I pay my tithes. Just give me a word for these women. And so the really inspirational thing for me about real and what it represents, and Gita, I really hope that you all, Lori and Erica, will be pleased with me being the kickoff to getting the wheel spinning, is that you all are helping women transition through various aspects of their lives. And whenever you hear the word transition, you think change. Change is like a metamorphosis, and it is not at all comfortable most of the time. It's scary, it's nerve-wracking, and you're not quite so sure how it's all going to end up. And the transition might be divorce. It might be, loss of a spouse, loss of a parent. And certainly in my profession, it's occasionally helping women and families deal with the loss of a child, which is, really sad. It can also be women that are transitioning back into the workforce, women that are exiting the workforce. So the fact that you all are providing an outlet and a venue for women to tap into, I just really take my hats off to the three of you ladies for just providing an exceptional resource to the community. The other thing that I'm going to say to you that I shared with you, Gita, when I walked through the door, is that I think that this group is an example of the brilliance of just women and who we are collectively. I mean, women, we communicate, we connect, we just get it done. We recognize a need and we fulfill it. So to you three that have come up with this amazing organization by sharing your collective experiences, just really kudos to the three of you. I'm really, go ahead, yeah, they deserve a huge applause. I want to say to you that I am deeply honored that you all selected me to be your first speaker at your very first event. I mean, the gesture is just beyond. The other thing that I'm going to express to you is that I think that it was a brilliant choice. And, honestly, my wife will tell you that I don't lack in ego. But the choice really has nothing to do with who I am, but it has everything to do with what I do. And what other profession can you think of that on a day-to-day basis witnesses and sees the transitions and the stages that women go through on a day-to-day basis? I am an OBGYN. I have, contrary to popular belief, the best job in the entire world. Where else can you dress up? And this is how I walk into the office. I typically don't wear my white coat because I think that it presents somewhat of a boundary to patients. I find it to be a bit off-putting. But I walk into the office in my most confident self, ask Dr. Angela, and we talk face, body, and fashion. That's one of my wife and my favorite phrases because we're girls in my house. I think that my dog Franklin, who was the only male, probably is gay. But we're all girls in my house. And so I walk into the office and I see my patients and we talk face, body, and fashion. We talk family, we talk relationships, and in the midst of all of that, I sprinkle in a little bit of medicine. And so what transitions do I see that are happening in women? I see young girls developing into women. When young girls first get their periods and their moms bring them into me and they're like, oh my gosh, what do I do? They're irregular, they're heavy, she's bleeding to death. All the while, moms have forgotten that they either have previously had periods or that they are still having periods and that they really know the answers to these questions, but they just want to bring them to me. I see a lot of high school students. And things that we talk about at their visits are, you know, the obvious screening guidelines. And just FYI, the first time that young girls typically come and see someone like me is between the ages of 13 and 15. And there's no exam involved, so make sure that you say that. But it really is just an overview of what they can expect. It's a review of the anatomy and physiology so that young girls can become more knowledgeable and comfortable with their developing bodies and what to expect, etc. So when these teenage girls that I'm seeing, we talk about screening guidelines and the fact that pap smears do not start prior to the age of 21, and that prior to that, there really is no reason for young women to be having a pelvic examination unless there's something really imminent going on. We talk about STIs, that stands for sexually transmitted infections, and hopefully after I've gone over all of that, that has scared the bejesus out of folks to either prevent young ladies from having sex or making sure that they're practicing safe sex. We talk about consent, and certainly in this age of the Me Too movement, we need to know about what informed consent is and what that looks like. You know, I see women that come in after they've gotten married and, we want to have a family, and I help couples to get pregnant. And then I see women throughout their entire pregnancies when they're finally at that just get the baby out stage. And then I see women post-delivery when the realization finally hits. This momming gig is flipping hard. I don't have any personal space anymore. I don't have any time for myself. I'm a mom, I'm a wife, and in a lot of our circumstances, we're also working moms, and nobody ever told me that it was going to be like this, and I'm overwhelmed, and I'm not supposed to say that this is hard, or that I'm having a hard time, or that I'm struggling. But the fact of the matter is, and the reason that I appreciate being Dr. Angela, is that I see this every day. And my job is to let you know that you are not the only ones that feels this way, because society certainly puts out there that we're supposed to be everything to everybody, but it is okay to have moments of weakness. And that's where we come together as a community to be able to rely on one another. And then certainly I see the whole, and I'm going to just date myself a little bit and tell you that I fall into this group of the whole perimenopause to menopausal age range, where our periods are all over the place. We might be having hot flashes and night sweats. The children have gotten older and don't need us any longer, and they may be going off to college, and now we're empty nesters, and we have to learn to get to know the partner that we've been with through all these years. Because certainly once you take the children out of the relationship, it becomes a whole new ball game, because the two of you, whoever you're with, now have to reconnect and get to know one another. And that's a very difficult transition, because the children sometimes serve as a buffer in your relationships. And certainly for those of us that are not in long-term relationships but have gone through divorces or separations and are now dating, I'm having the conversation of safe sex. It's not just for the young people. I'm having the conversations about contraception. I'm going to tell you all that I can count on one hand, it usually goes to about 5, the number of women that are in their 40s, mid to late, that surprisingly enough come up with that uh-oh baby, because they didn't think that it could happen to them because they're not using contraception. Having those kinds of conversations about what is available to you, based not only on your age, but your pre-existing conditions and medical comorbidities that may or may not be amenable to you being on some kind of contraception. Talking about the changes that all of our bodies goes through. I had a very interesting conversation with my wife this morning. I woke up at like 4 this morning because I had no idea what I was going to be saying this evening, and I had to prepare because I had a very busy day in the office. And I said to my wife, can you please just find me something to wear? And so at lunch, I called her and I said, what did you get me? And she says, oh, I picked you out something great. And Francesca, who was our 9-year-old daughter, helped. And my first question to her was, what size is it? And she said, it's a 0. And the only reason that that's significant is because it dictated that I would not be eating lunch on today because I needed to be able to squeeze into my outfit. So I will be having a very real meal after this. And so, Gita, when you came to me and you said, this is what I want you to talk about. I want you to talk about, topics that women want to know about that they're embarrassed to ask. I took that to task, and I have to tell you that it was really difficult for me to come up with a list because I posed this question to my patients, even as far as like my last patient at 3:45 today. I said, what is it that you're dying to ask me that you're embarrassed to ask? And my patients, of course, said to me, and I will get to you, but my patient said to me, well, Dr. Angela, we're not embarrassed to ask you anything. And they're right, because I'm telling you, not only are my patients asking me everything, but women across the country via direct messaging on the internet and social media or via direct emails, they're asking me all kinds of questions. And so I said, okay, what about your friend? Because, we all have a friend that we ask questions for. And so between my patient's friends and my medical assistant, I came up with like my top list of things that women, are embarrassed about and that they really want to know about but are kind of afraid to ask. And so number 1 on my list is discharge. It's amazing, discharge. I love discharge, not in the way that you think, but discharge is... Discharge is really amazing to me. It's like the new milk. I say, got discharge? Remember that got milk commercial? It's like this thing that everybody has, but no one is talking about it. I'm like, are you kidding me? Come on. And so this is what I'm going to tell you about discharge. Certainly, the amount of discharge that women have varies depending on where they are in their menstrual cycle. Sometimes it's certainly more copious or greater in amount than others. Sometimes the consistency changes, it's thicker or thinner. As long as it doesn't itch, burn, or smell bad, nobody cares. It's fine. And trust me, when you don't have it, you are really going to miss it. Because I've got a whole group of women in menopause that are dying to get their discharge back. Why? Because, I know. Because their vaginas and vulvas are now dry, they're itching, they're burning. And Michael, I can throw this out to you. It's really cool when men kind of scratch their crotch, but what do you think when a woman does that? Not so appealing, right? Not so much. And so, moving along, the other topic that typically comes up for me. Yes, sure.
If the discharge is slippery, does that mean that you're ovulating?
Yes, it typically does.
I just wanted to confirm.
Yes. Yes. Because I'm going to compare your vagina, which is an amazing organ, which is probably one of my favorite organs. Pardon the pun. I mean, I do have a wife, but that has nothing to do with any of this. The vagina, if you're going to compare a vagina to appliances, is like a self-cleaning oven. Okay? It takes care of itself. So the discharge that you have oftentimes is the vagina's way of self-cleansing, sloughing off old cells, etc. So that's actually a great question. Less is always more. You do not need all of the scented and perfumed soaps, etc. Okay? Because that oftentimes, yes, not only do those things serve as irritants, but they predispose you to the vaginitis that you oftentimes come and see me about. And those particularly are either yeast or bacterial vaginosis. So having said that about vaginitis, the second thing that comes up for me all the time is sex. Dr. Angela.
Sex or sex?
Sex. S-E-X. Sex. Sex. Comes up all the time. Oh my gosh, Dr. Angela, I just want you to know. And these are the two scenarios that I see most often. The first is usually like a young mom, a wife, and she says to me, I just don't have any desire. I don't have any interest. Is it just me? And of course, the advantage that I have is all of my patients are women. I just saw like 5 of your girlfriends before you came in. And again, there's no communication. But I'm like, you are not the only one. And so one of the things that I often will ask these women, humor me and tell me, give me an example of one day out of your week. And so this is how it typically goes down. I get up in the morning, I may exercise, and then I have to get the kids up, I have to get them ready for school, I have to make sure they have something for breakfast, I have to take them to school, and then I have to go to work, and then I have to pick them up from school, and then I have to take them to all of the after-school activities, which is usually soccer, gymnastics, karate, music lessons. And then I have to come home, and then I have to cook dinner, and I have to review the homework, and I have to make sure that they do the homework, and that we don't have any tests to study for, and we have to brush our teeth and wash our face, and I have to get them to bed. And then when you look at you, all of you, most of us have not eaten dinner. We have not had an opportunity to have a normal conversation with our spouse, like how was your day, anything exciting happened. And by the time all of this happens, and I can attest to this because this happens in my own household, and my wife will tell you that after all of these things, she does most of that stuff, and I come home, I review the homework, I eat a meal, I say my prayers with Francesca, she goes to bed, and by the time she gets home, I'm like this. Like just gone. And women are the anchors of the family. And I'm not man bashing Michael, but most of it falls on us. And after doing all of those things, and then having to wake up and do it all over again and again, where does sex and intimacy fall on that list? Way at the bottom. So what I typically say to women in response to this is, number one, you are not alone. And I have seen about 15 other women today that have said the exact same things to me. But the one thing that I do offer to them is, number one, I dare your husbands or your significant others to do even a tenth of what you do, and then we'll see where that intimacy ranks on their list, who typically just go to work and come home and maybe hang out with the kids a little bit and then expect you to do what you do. Okay? So get some help and try to find some times to prioritize. And Gita, you and I were talking about this actually earlier.
I sleep all day.
Good for you. Good for you. And so, Gita, you and I were talking about this earlier. Today, you were saying to me, oh my gosh, you and your wife look amazing. And it's because exercise and physical fitness are very important for us because we have a 9-year-old that we have to be able to keep up with. So in our relationships, collectively, it becomes about prioritizing and being able to speak up and acknowledge the things that you need and making time, even if it's just 5 or 10 minutes, to do something for you. Okay? That's really, really important. The other thing with sex that I get is from my more senior population, and I'm going to tell you, y'all, the seniors are doing it. And I mean that both literally and figuratively. Like 65 and 70 is like the new 40. Okay? When I collectively tell you that the STI rates, that sexually transmitted infection rate, in the senior population has gone through the roof, it's because they're having, girl, I'm telling you, it's because they're having a good time. So the other piece of the conversation that I have as relates to sex is, oh my gosh, Dr. Angela, it hurts. And I'm only doing this because it's what I have to do as a wife. But it's really painful. And certainly, you know, we need to be able to talk about, why is that? Is it because you're menopausal? And certainly once you hit menopause, you know, the whole architecture of the vagina changes. You no longer have that, what we call estrogen effect. And as a result of that, you no longer have all the folds, or technically speaking, rugae in the vagina that helps the vagina to stretch and be able to accommodate. You no longer have the moisture or that discharge that we used to all be so annoyed about to help to lubricate. But the tissue becomes thinner, it becomes paler, it becomes less accommodating. And as a result, we're all saying, ouch. And I don't know about you, but I don't want to do anything that's painful. So being able to speak in an open environment about these things becomes more and more important. And being able to recognize what the underlying condition is, whether it's vaginal atrophy, I can give you some estrogen for that. If there's an underlying infection like vaginitis, I can treat that. If it's something in my younger population like endometriosis, sex is supposed to be pleasurable, not just for the man, but for women. I know, right? And one of the things that I'm really happy that you all are having this group discussion about is women, we need to start taking care, better care of ourselves. And one of the reasons that I love vaginas so much, and we're speaking medically here,
Thank you.
You're welcome, is that, you know, vaginas are amazing, you know, but what I'm going to tell you is that if you don't use it, and I tell my older population this all the time, if you don't use it, you will lose it. Your vagina needs exercise. And the great thing about vaginas is that they love individual sports. And you can read between the lines on that. As well as team, and in some circumstances, no judgment, group activities. So I'm just saying. And last but not least, the third most common thing that women become increasingly more uncomfortable to talk about is our bodies, our body image. Oh my gosh, you know, one breast is bigger than the other. Oh my gosh, one of my labia are bigger than the other. One is more slightly discolored than the other. And I see this a lot, surprisingly enough, in my young population. I saw, all jokes aside, a young lady, she was 14 years old, and she came to me with her mom because she thought that her vulva was abnormal. And I was like, are you freaking kidding me right now? And I'm saying freaking because I don't want to offend anyone, because I really want to drop the F-bomb. I'm like, are you kidding me right now? And she's like, yeah, my boyfriend said that it looks funny. Yes, I know. And so, of course, what I said, my response was, okay, so who are you going to believe? Your boy, and the emphasis is on boy, friend that's seen maybe 1, 2 vaginas and vulva at the most in his young life, or Dr. Angela, who has seen thousands of vaginas and vulva and breast, and is telling you that what you have is a variation of normal. And no, I don't need to take you to the OR as much as I love to operate. Unfortunately for you, I do not need to take you to the OR for this. So part of bringing those young girls to the office at such a young age is educating them about their anatomy, getting them to appreciate the changes that are going on in their bodies, and getting them to love who and what they are and what their bodies are indeed capable of. I hate when women come to see me and the first thing out of their mouths are, oh my gosh, I'm so sorry, Dr. Angela. I didn't shave today. I didn't groom today. I didn't do my toes. And my response to them typically is, no worries. I have a wife. You don't have to impress me. If you like it, I love it. My girl Carrie out there and I have a running joke about the status of Bush in the community. When you happen to be friends with an OBGYN, or if you happen to be married, Gita, to an OBGYN, certainly the topics of conversation are many, whether it's, is the Bush back? To, babe, can you take a look at this? Is this normal? So whether you shave, wax, laser, I don't care. If you like it, I love it. Okay? I'm just saying it's whatever you want to do. But do it for you. And know that whatever you decide is okay. It really is okay. And whether we're also talking about incontinence issues, oh my gosh, I had the kids, and now when I laugh, when I sneeze, when I cough, I leak a little bit of urine, a lot of urine, or I have to change my clothes because I laughed so hard I peed my pants. It's all good, because these are things that I see on a daily basis that women are so afraid to broach the topic of conversation because they think that they are the only ones. The other thing that I commonly talk to about in Tasha, this is like her favorite, but I see a lot of my older patients that deal with issues of prolapse. And they're like, oh my gosh, Dr. Angela, I feel this bulge in my vagina. Something's falling out. At 3 in the morning, I'm on call, and I'm like, yes, Mrs. Jones, what is so important at 3 in the morning that you're calling me? There's something falling out of my vagina. Is it normal? And it's prolapse. And it's normal, it's natural, it certainly can happen as we age, and it's not going to kill you. But the reason that I'm telling you all of these things is that it's all normal and natural stuff that happens to our bodies. And one of the amazing things that I love so much about what I do is I see women from all walks of life, all ages of life, and certainly now I have a special appreciation for my more elder patients because they're in menopause and they're telling about their symptoms. And I can write the book on menopause, but I've not yet experienced it. And so their forethought and their comments, what patients don't realize, and I'll share this with you, is that as much as you get from me, I gain an equal, if not more, amount of education from you. So it's a mutual, symbiotic type of relationship. And Gita, I'm going to be completely honest with you. Gita, Erica, Lori, I could stand up here forever and talk to you about the stories and the patients and the experiences that I've had being Dr. Angela. But I think that the gist of it is that social media, the internet, all of those things, if nothing else, it's taught me that no matter where we are in this world, most of us are more alike than we are different. And the interesting perspective that I have is that I have the pleasure and the privilege to be able to take care of a lot of women and to have them be able to trust me with their most sensitive, fears and concerns, and they share their deepest, feelings with me. And what I'm saying to you all is that you're not alone in the stuff that you're dealing with, whether it's, being a new mom and being completely overwhelmed and feeling like an inadequate wife or feeling like you're not enough. And the one thing that I love about being a woman, no man could ever do what we do. No man's body was built like a woman's body. That's why we have the children. And just, you're amazing, you are beautiful, you are inspirational, you are able. And Gita, I just want to say in closing that what you, Erica, and Lori have put together is really amazing. I'm truly honored that you asked me to kick off your organization. And women, I want you to always remember your power and your worth. As my girl Beyonce says, who runs the world? Girls. Thank you. And cheers! The reason that I'm saying this is because we just had this conversation. Literally 30 minutes ago. And our daughter is convinced that she has hair under her arms. There's nothing there.
But then my daughter, she came up on.
Yes. But having said that, this is the conversation that Tasha and I have all the time. Is that no. It's different now. It's different. Boom! There it is. The food is different. Girls are no longer lean and thin like we used to be until we were like 18. There are really, literally, daughters there are children in my daughter's class that are looking me dead in the eye and that are bigger than I am. So it could be, technically speaking, precocious puberty, where certainly sometimes young girls go through these changes a little earlier than others. But the other thing is, the kids are just bigger. And I don't mean that in a bad way nowadays. And it has to do with what we're consuming, all of these things. You know what? That's a great question. And I'm going to say yes, because it has everything to do with women being more mature and discovering other aspects of their sexuality. What most men don't get is that penetration is not the number one way to have a woman actually reach orgasm. So, boom. Next question. Yeah. So one of the things that I'm going to tell you all about oral contraceptive pills is I majorly prescribe oral contraceptive pills for non-contraceptive reasons. So a lot of young girls that I put on pills are not sexually active. Putting a young lady on birth control is not a free pass to start having sex. But most of the reason that I put young girls on pills has to do with either really irregular periods, really heavy periods that are interfering with their ability to either go to school or participate in extracurriculars like sports, really painful periods for which things like, old school heating pads, too much ibuprofen, Motrin, things are not helping. So putting young girls on a combination low-dose birth control pill for non-contraceptive reasons is the major reason that I put young girls on contraception. Having said that, what's really amazing to me is that no one ever talks about the benefits of being on a birth control pill. And so I'm going to let you in on a little secret. So 2 of the hugest benefits of being on a birth control pill, because everyone is like, oh my gosh, it's going to increase my risk for cancer. Just a complete aside, your overall risk of getting cancer from being on a birth control pill is minimally increased over your baseline risk of getting breast cancer. Age is an independent risk for breast cancer, okay? So the older you get, the more likely you are to come down with breast cancer, which is one of the reasons that, as opposed to pap smear screenings, which we typically can discontinue at around the age of 65 to 70 if you've had no significant history, I never recommend to women that they discontinue mammograms because, again, your age is an independent risk factor. One of the benefits of being on a combination birth control pill is that it is protective against endometrial or uterine cancer as well as ovarian cancer. So for your daughter to be on a low-dose birth control pill, I think it's fine. I would love to see the studies that her OBGYN is quoting with regards to that. Absolutely. So one of the things that I always tell patients, and again, this goes back to my ego and me being who I am, is whenever you're seeing a practitioner, my relationship and our relationship with you should be 50-50. You really bring as much to the table as I do. And any patient that I see, I welcome you to get a second opinion because I'm that confident in the type of medicine that I personally practice. And the other thing to make sure that you're kind of leery of is you don't want to be with a physician that is, patriarchal. And we live in a society where people tell us what to do. As an OBGYN, that is not my job. My job is to give you the facts so that you can make the most informed decision that you feel is going to be in your best interest. Now, I am obviously not going to let you do anything that's going to be detrimental to your health, but it's your choice. You don't need to be with a physician that is letting their beliefs or dictates interfere with what you deem is best for you. I love coconut oil, and certainly when you're starting to deal with things like vaginal dryness, etc., my go-tos with regards to vaginal dryness are coconut oil, olive oil. They do the vagina good. As long as you're not afraid to, God forbid, touch yourself, you're good. Yeah, you lube up your vagina. It's good for your skin, your hair, everything. Everything. Yeah. There are so many different options for dealing with dryness. I mean, you can try more natural things, whether it's olive oil, coconut oil. You can try vaginal estrogen. Like, the sky really is the limit. You can try, vaginal probiotics, vaginal moisturizers. Perfect. Yeah. Yeah. I'm sorry? This is what I want to tell you about bioidentical hormones. I am really a kind of guideline type of practitioner. And my wife will tell you that whenever I come home and I talk about stuff, I'm always quoting the guidelines. Having said that, I do have quite a few patients that use bioidentical hormones, and my message to them primarily is, if you like it, I love it. But having said that, my only kind of hedge on that is that it's not FDA approved, and there's no concrete way to ensure what you're getting in every batch. If you want to try it, exactly, you can give it a go. But as an OBGYN, where I get kind of, if we're going to be completely frank with you, pissed off, is when I have family practitioners, internal medicine, or other non-GYN people doing this, and then I have to clean up the mess because you don't know in turn how to manage the complications or the irregular bleeding, etc., that are associated with that. If you want to give it a go, I'm all for it. Having said that, my fallback is always just know, this is outside of the guise of what, the guidelines suggest or recommend. But if you want to give it a try, go for it. I have a ton of patients that use it, that love it, but then I have some others, not so much. This is actually a great question. Until recently, the recommendations for the HPV vaccination were between the ages of 9 and 26. They recently approved a new vaccine for older than 26. Okay? It's a huge span. But having said that, cervical cancer is not a cancer that you want to get. Let's look at us. I'm going to get to you. In general, all of us probably had chickenpox at some point in our lives. When is the last time you currently saw a kid with chickenpox? It's almost unheard of. Why? Because there's a fucking vaccine for chickenpox now. Cervical cancer is no joke. Pap smears, you can say whatever you want to say about screening. Pap smears are one of the most effective screening tests on the market. And if I say to you that I can give you a vaccine that will prevent you from getting the most common causes of cervical cancer, you better bet your bottom dollar that I'm going to recommend that, okay?
You don't have any negative.
I do not have any reservations. And it is certainly a vaccine, and I'm sharing this with my wife now, that I will let our daughter get. And it is not only for the girls, but it is also for the boys as well. Because the thing about HPV, and I will share this with you, during the course of my office day, and I average between 35 and 40 patients a day, I'm doing at least 2 to 3 colposcopies per day. What the heck is a colposcopy, Dr. Angela? A colposcopy is a procedure that I'm doing on women that have had an abnormal pap smear. The purpose of the colposcopy is for me to see if the pap smear missed anything. So the purpose of the colpo is for me to take a closer look at your cervix to make sure that there is nothing more significant going on, okay? If I tell you that there is a vaccine that's available that will, most cervical cancer is associated with 3 types of HPV, 16, 18, and 45, because there are hundreds of different strains of HPV. But in my realm, i.e. GYN, I'm not even speaking obstetrics here, but in the realm of GYN,
What would be the youngest age?
we make
Say
9. We make our world a lot easier by dividing HPV into 2 categories, low risk versus high risk. The low risk, nobody really cares about. Those are the types of HPV that are associated with things like genital warts, okay? High risk HPV, specifically strains 16, 18, and 45, have like a 97% association with cervical cancer. Okay, so if I can give you a vaccine that is going to prevent that, that's really a no-brainer for me. I mean, you can feel however you want to feel about vaccinations. I have this conversation with my pregnant moms every day.
Like they don't want to vaccinate.
Yeah, you know what, whatever. My job is not to argue with you. I'm just going to give you the facts, and you can do whatever you want to do. Again, this is about making an informed decision, but I am very pro the HPV vaccine because cervical cancer is no joke.
Yeah,
The surgery that's associated with that is like crazy. I mean, that's not something that you want to get. If at all, you can prevent it. So I'm just saying, this is straight from an OBGYN who happens to have a daughter. So, yeah, that's like a no-brainer for me. I always get this from patients. My periods are always this way. They're like clockwork. I mean, shit changes. We're getting older. Our bodies are changing. I'm just being 100% real with you. You know, everything is not always going to be the same. And certainly you're a good 40, but your body is also changing and evolving. And this might be your new normal. On average, you know, perimenopause lasts for like 4 years.
I mean, would I still be able to get pregnant?
Yep. And what that period is characterized by, any number of things. You might start skipping months at a time. You might get periods multiple times a month. You might start having spotting in between. You might start getting some hot flashes, night sweats. But what I said during my presentation was that a few times a year, and this is why discussions on contraception is always important, I see a woman that thinks, oh my gosh, it can't happen to me. My periods are so irregular. You know, but all it takes is one time. One time being the right time, and it can happen. Yes. So by definition, menopause is an entire year without a period. Okay? And then you won't get pregnant. But in women that have had things like hysterectomies, you just get an FSH level. And typically, I think the cutoff is 25. If your FSH level is greater than 25, then you are, you know, technically considered to be in menopause. And menopause is different for all women. Not everyone gets the hot flashes, the night sweats.
Perimenopause like an early lead on?
Perimenopause is the transition towards menopause. It's everything that I just said. Okay? And on average, that lasts for about 4 years. That's a great question. And so what I'm going to tell you is that as long as you don't have any medical comorbidities, and by that I mean contraindications to being on something with estrogen in it, those are things like high blood pressure, hypercholesterolemia or elevated cholesterol, family history of clotting disorders or bleeding disorders, history of migraines with aura. I have many patients that I transition right into menopause on a low-dose birth control pill because that in turn helps to keep periods more regular, and it also helps to stave off some of those conditions or symptoms that we typically get, the hot flashes, the night sweats, etc. But every year when I see you for your annual exam, if you happen to be on a low-dose birth control pill, annual exam, one of my first questions to you, have there been any changes in your medical history? Are there any reasons that forbid you from being on a low-dose birth control pill? And if the answer to that is no, then you can easily transition right into menopause. And how do I typically test women for menopause if you're on a low-dose birth control pill? Is during that placebo week or the non-hormonal week, right before you start your next pack, I draw an FSH level. And if it's greater than 25, then you don't have to be on it anymore. There it is. So as long as your hysterectomy was done for a benign reason, i.e. something like endometriosis, fibroids, adenomyosis, and you have no history of any abnormal pap smears, then the answer to that is no. Because what do pap smears screen for? Cervical cancer. And if you no longer have a cervix, no. Next question.
Where's your practice?
That's a great question.
And are you making it easier?
I always take new patients. I will never be close to new patients. And in response to that, I happen to have the privilege of working with the Ciprianos, Joe and Rebecca, and I am the medical director at the Jackson location. Having said that, I also occasionally have office in the Freehold location, And we also have a location that just opened right up the street in Shrewsbury as well as in Lakewood. Yes. The other great thing about that is we offer evening hours. We all have like a 12 to 8. And we also are open on a Saturday from like 8 o'clock until noon. So, yes, always. It's really cool. I'll be a little bit selfish here and tell you that the podcast, the blog post are really for me. It helps to keep medicine relevant for me. It makes it fun and exciting. And as a result of that, you all benefit. So, thank you. Thank you.